Child tooth decay represents a much bigger public health issue than appears to have been recognised so far. It's a problem affecting millions of children, including some of the most vulnerable. It should be a real concern to us all.
As a nation, we can't be leisurely about this. It is a public health emergency. There is a degree of urgency to this issue.
Children losing their teeth must be seen as a health failure.
That it's extraordinary that it appears that there are more children going into hospital due to poor oral health than broken arms, whereas I think when we were children it was definitely the other way about.
When it comes to oral health, too many of our country's children quite literally have nothing whatsoever to smile about. The economic costs of childhood tooth decay are as unsustainable for the NHS as the human costs are unacceptable for the child.
As a children's doctor, as a consultant paediatrician, I'm responsible for the children on the children's wards in Peterborough Hospital I work at. And children come in because they're unwell normally, but these children are coming in not because they're unwell, but essentially because they've had too much sugar and not had their teeth brushed effectively, such that their teeth have gone rotten, become painful and uncomfortable, and need to be removed.
The problem is basically education, and it is a problem that's gone on for decades. We do need a national oral health programme like Scotland. It should target poor areas of poor health. Prevention must be the way in which we go forward.
Dentistry remains a highly siloed service in the NHS and has been largely neglected from future NHS plans, such as the 5-year forward review and sustainability and transformation plans.
For too long, oral and dental health has been overshadowed by the understandable concerns in other areas of the NHS. For too long, oral and dental health has been the Cinderella service of our NHS, and this must end.
Drastic action must be taken, and for this to happen there must be a funding regime set aside to do more in schools, but also through the healthcare system.
Since 2006, dentists in England have been paid units of dental activity. This means they are not rewarded for prevention, whereas our dentists are paid for doing fluoride varnishing. They are paid for doing fissure sealant. And therefore it's undermining the basic principle.
But if the issue of tooth decay was made a priority for the NHS, a great deal of money would be saved. Let's really show we care about both the dental health and the general health of our future generations and take action now.
This goes beyond the suffering of the children as well. We cannot afford for our economy to ignore this. Last year, 1.2 million working days were lost as parents took time out of work to care for children who had oral health issues. The impact on the NHS and on child well-being is absolutely crucial going forward. The British Dental Association said these shocking statistics are rooted in an abject failure by government to tackle a preventable crisis. I hope that the Minister is going to talk to us about his plans to reform the dental contract, and that we will go on to see a dental contract in England that has at its heart prevention and builds it into it an element of sustainability for the dental practices.
I think it's important as the Minister that I acknowledge and put on record the vital role that dentists play in this. They're a brilliant part of the NHS. There are just over 24,000 dentists currently providing NHS dental care. Their commitment and contribution is vital to delivering our wider health and public health aims. Our manifesto sets out this government's continued commitment to introducing a new NHS dental contract, which will improve the oral health of the population and increase access to NHS dentistry. It's a serious business. We take it seriously.
Addressing tooth decay is not complicated. We know what works, and the actions I have outlined today could make a real difference.
I urge the Minister to take action. It is long overdue, and inaction is not an option. Our children and young people, quite frankly, deserve better.